What if an AI could help spot the early signs of oral cancer? Welcome back to Summarize Science. Today, we're looking at a new deep learning system designed to classify different kinds of sores or lesions in your mouth. Oral cancer is a serious health issue, and survival rates drop dramatically if it's diagnosed late. A major problem for doctors is that dangerous lesions can look a lot like harmless ones. To train an AI for this, you need thousands of pictures, but some oral diseases are quite rare. The researchers started with a dataset of about 2,000 images, but it was imbalanced, with many pictures of common lesions and very few of the rare ones. This imbalance can bias an AI, making it great at spotting common issues, but terrible at identifying rare, but potentially more dangerous ones. So, how did they solve this? They used a technique called data augmentation. Essentially, they took each training image and digitally created new versions of it. They flipped them, rotated them, and changed the brightness and contrast. They also specifically duplicated images from the rare disease categories, a process called oversampling. This simple-sounding step was the key to their success, creating a much larger and more balanced dataset for the AI to learn from. For the model itself, they didn't start from scratch. They used a powerful, pre-trained architecture called EfficientNet v2b1, which has already learned to recognize features from millions of general images. They then fine-tuned this powerful brain to specifically recognize 16 different types of oral lesions. And the results were impressive. As you can see in this table, their method, the stratified augmented CNN, achieved an overall accuracy of 83.33%. This score beat out many other well-known deep learning models, including different versions of ResNet, VGG, and even other efficient nets. The model showed it could reliably identify several types of lesions and even achieved a perfect score in recognizing squamous cell carcinoma in the test set. The researchers noted that without their data augmentation and oversampling techniques, the accuracy was stuck below 70%. This shows just how critical it is to properly prepare the data you feed to an AI. So, to recap the important points, these researchers built a highly accurate AI for classifying 16 different types of oral lesions. The key to their success wasn't just a powerful model, but their clever strategy of digitally creating more training data to overcome the problem of having too few images of rare diseases. What does this mean for the future? This isn't about replacing dentists or doctors. It's about creating a powerful assistant that can help them make faster, more accurate diagnoses, especially in the early stages when treatment is most effective. Future work will focus on using even larger, more diverse datasets and making the AI's reasoning transparent to build trust with clinicians.